Good morning. It's Thursday, July 16th, 2009. I'm Jilly Badanes, and this is the morning briefing, a rundown of the stories we're following here on WashingtonTimes.com. Thousands of Afghan civilians are working on U.S. bases and assisting troops as interpreters or in law enforcement. But now, because of that work, they are becoming increasingly under threat of attack. As the U.S. boosts its troop presence in Afghanistan, the Taliban is ramping up its attacks on Afghans working with the U.S.-backed government. The Washington Times has learned exclusively from U.S. and Afghan officials that the Taliban has been committing targeted assassinations over the last year to try and weaken the link between government and citizens, creating a huge obstacle for Afghan officials trying to gain control. Meanwhile, back in the U.S. on Wednesday, Secretary of State Hillary Clinton reached out to any members of the Taliban willing to quit fighting and renounce al-Qaeda. She timed the statement to encourage maximum participation in the country's presidential election, which happens in late August. And the healthcare debate is fully underway in Washington as President Obama's healthcare reform passed through its first congressional committee yesterday. The Senate Health, Education, Labor, and Pensions Committee passed a $600 billion bill, which would create a public health insurance program and require Americans to purchase insurance. As four other bodies in Congress continue to work on the plan, the Democratic National Committee yesterday released new TV ads in states of swing vote senators.